Welcome to Adapt and Class. If psych medication make you feel overwhelmed, confused, or at the end of your studying, you feel like you don't remember anything, this video is for you. Don't memorize 100 random psych medication. In this video, I'm going to give you 6 steps to be able to study psych medication in the right way, smart way, and answer questions confidently. What is the issue? Stick around, listen to the lecture, then we have questions to put it together. You will love to watch this. Let's go. First thing, we should not study medication based on the name of the drug, just the class. Because if you do that, you don't have to memorize thousands of medication. Very important to focus on the class. And therefore, 5 classes. 1, antidepressant. 2, antipsychotic. You see, 2. Next one, mood stabilizers, anxiolytic, and ADHD medication. These are 5 classes of medication. You don't have to memorize. All you need to know is to know few of the medication in that group. And when you see them, put it together. Class of medication. Group them as antidepressant. Remember, antidepressant has different subunits. They can be atypical or typical, but it does not matter. I'll show you strategy to memorize them in a simple way. If you master this class of medication, you can answer any questions, no matter what they give you, unless you can recognize the medication. That's the key. Now, focus on what kills the client. That's what the NCLEX is going to ask you. Medication has tons and tons of side effects. You don't need to know everything. If you put it in the class, you know which class of this drug, what they do. Each class of drug do specific thing. So focus on that side effect that kills the patient. Therefore, example, most dangerous one. If we take antidepressant, the common one, Fluoxetine. This is SSRI. What do you think? This specific side effect is common for any antidepressant, right? Increase suicidal early in the treatment. So you need to see them, 1 to 2 weeks. You should not pass that. The first 2 weeks need to be seen. Serotonin syndrome is specific for SSRI. And that is what you're supposed to know. Fluoxetine, the major side effect, suicide, and serotonin, which is specific for that class. What is the MOIs? These are hypertensive crisis medication. If you take it, the major side effect the NCLEX is going to ask you, what is going to kill them is what? Hypertensive crisis. Your best thing to do is to remember which one are MOIs. And that's the major problem. If you take TCA, tricyclic antidepressant, there are major side effects. There's a bunch of them, but cardiac arrhythmia and confusion. Sometimes anticholinergic effects. You see what I'm trying to do? I want you to focus on these little words, but you have to be, you should be able to recognize the medication first. They're going to test you, what do you monitor based on the bad side effect. How do you teach them to prevent the bad side effect? When to report it so that when you see the bad side effect, you intervene. It's the same question they ask you when they say monitor, teach the client or report. You are monitoring the side effect that is going to kill them. You're teaching them the side effect that is going to kill them. And with symptoms, when you see it, you intervene, risk reduction. That's all. Now, focus on what kills the client. Another medication, antipsychotic. What do you think kills patient if they're on antipsychotic? 2. Example is Haloperidol. This is the first generation. Neuroleptic malignant syndrome. This is when they have muscle rigidity, the temperature go up, they have autonomic dysfunction. All of this is a major problem. When you see it, their temperature is high with the lockjaw. This is NMS. And extrapyramidal symptoms? This is associated with motor issue. EPS is more motor issue. It's designed to give you strategy, but if you want details, what are specific about extrapyramidal symptoms and NMS, check Adapting because this video specifically talk about it. But I'm just trying to show you some of the things. If you hold on to that, you'll be able to answer the question. So EPS is mostly what? Motor function defect, and NMS is usually what? Autonomic dysfunction problem. Things that will kill the patient. Another antipsychotic, clozapine. What is the major side effect that is going to kill you? Agranulocytosis. I'm just showing you things so that when you study, you can pay attention. You see, I'm focusing on not all, there's so many side effects of clozapine. Weight gain, right? Drooling. They are all expected finding. Hyperlipidemia, diabetes. But if they tell me to pick one answer choice, agranulocytosis. Same thing. Dapraxidone is an antipsychotic. It's a second generation antipsychotic. But what is the number one thing that I should worry about? QT prolongation. It also has agranulocytosis, but it's specific for QT prolongation. You see what I'm doing? That's what I want you to do. That's step 2. NCLEX love asking you which finding require immediate intervention. It means what will kill the patient. You got to intervene. Rate reduction. Another class, mood stabilizers. That is what we use for bipolar. The most common one, if you don't know anything at all, lithium. And the major side effect is GI side effect. If you see nausea, vomiting, that's toxicity. Severe side effect is like confusion, seizures with the narrow therapeutic index. But before we get to seizures, I want you to intervene by stopping me if I have nausea and vomiting. You see? Valproic acid is also anti-epileptic, is a mood stabilizer. The major side effect is pancreatitis. Carbamazepine, agranulocytosis. So I'm picking one information about this class of this medication. You can see lithium is number 1, but there's little ones that you can put in. If you know it, when they ask you a question, this is the one it will ask you. Same thing, right? Now, the last group is anxiolytic, anxiety medication, lorazepam, the LAM and the PAM. What is the major side effect? Withdrawal and sedation. You cannot take alcohol with it. You cannot take any downer. That's the way you have to think to prevent injury to the patient. Teaching them. It's dependent. You cannot stop it right away. If you stop taking it, you get seizures. You see, that's the thing. Now, number 3. After we've studied them, we know what they are. Now, we look for pattern, not one symptoms. We look for pattern in case when they give you, you can recognize, oh, this pattern belongs to this group. And what is the pattern? Initially, I give you the individual major side effect. Now I'm giving you pattern in case for a case study. But in case they give you a bunch of side effects, you know these are the pattern. But the most important one is the one we talk about. What is antipsychotic? You're going to see this pattern. Weight gain, diabetes, metabolic syndrome. That means they have hyperlipidemia. All of them. Diabetes is not important. Those are expected finding. And so they come in group. They cluster these symptoms. Ignore it. Pay attention to agranulocytosis. Pay attention to QT prolongation. Those are our side effects. Or NMS or EPS, depending on which one they give you. If you have tricyclic antidepressant, you're going to have a pattern. What is the pattern? I call it dance. Like I said, check ADAPT and class, you see more of it. What is dance? They're going to have dermatitis, skin rash. They have anticholinergic effect. They have neurological problem, confusion. They have cardiac arrhythmia. And the E, you got to evaluate them. These are all the signs and symptoms of what? Tricyclic antidepressant. I put it together as acronym. That's what they mean. Pattern recognition, right? Now, SSRI, you're going to have GI upset, you're going to have GI upset, you're going to have sexual dysfunction, you're going to have insomnia, you're going to gain weight, right? But the major side effect I told you is suicide within 2 weeks. And what? Serotonin syndrome. But these are patterns, you know that, oh, this is expected finding. I should ignore it. MOI. I said hypertensive urgency. What pattern would you see? Monitor their blood pressure. Avoid nasal decongestant because you causes what? You will worsen the situation. You have hypertensive urgency. They should avoid harming food. Worsen their condition. They have hypertensive urgency. So patterns stick better. You memorize the pattern. You say, oh, if I see MOIs, I'm looking for hypertensive agency and for them to avoid thiamine food or decongestant. And the basals we talk about. Don't stop it abruptly. You have to slowly wean yourself off. Otherwise, when withdraw, you have seizures, and then if you depend on it, it's a problem. And the amphetamines, these are for what? ADHD patients. They are stimulant. In them, you're looking for what? Growth restriction. They are not going to grow. It's an appetite suppressant. So it's, but at the same time, it's a stimulant. They have hypertension and hallucination. So these are patterns you have to see. Say, oh, I remember this is what they do, not the name of the medication. Now, know the NCLEX star question that you should expect. This is the way they're going to ask you. Pharmacology is going to ask you, what are you going to monitor based on the bad symptoms? What are you going to get concerned about? Bad symptoms. What you are going to teach them? Things they should look for the bad symptoms. When do you hold it? When you see the bad symptoms. What indicate the medication is effective? You're treating the problem. That's the strategy, step 4. Now, this is the best one. If you don't remember anything, everything is based on that. If you ace number 5, step 5, you ace 1, 2, 3, 4 already. So make it like a puzzle. Don't memorize it. Don't keep on reading them and you have no clue how to connect them. Group them into class. How do you group them? This is your exercise. Make yourself a puzzle. Those random flashcards, I don't think you help. Once again, flashcards is not going to help. You can write 100 medication name on a flashcard, but then you have 100 flashcards to deal with. You just have one. Do one flashcard with a bunch of names. And what you do, circle them like a puzzle. Group them together. Which of these belong to each other? Like I said, I will do it, but if you know it, you can stop the video and do the same thing. But this is designed to just give you strategy, but the actual content, you can find it and adapt NCLEX. And I will link it to this video with NCLEX content, nursing school content on psych medication. So how do we group them? Fluoxetine. You have to know that this is SSRI. And you can see from the last step, sitting, that's that group of the medication. I look around and say, which one is sitting? So keep on doing it every day. When you look at this, you write it on a sheet of paper, and then you keep on circle. Does this also SSRI? You can see there's another sitting here. You see the last name? Oh, it belongs together. That's another SSRI. I see carbamazepine. I said, no, it's not SSRI. I don't see anything. But what? It's an antidepressant. So these are SSRIs. I look, I don't see anything anymore. But what do you see here? Citrulline. It's another SSRI. It's a different kind of SSRI. And you keep on doing it until you ace this puzzle. So that's what I want you to do. Keep on doing it and master the strategy of knowing psych medication. The next thing is, I see carbamazepine. This is what? It's a mood stabilizer. It's anti-epileptic. So it's a mood stabilizer like lithium. You can put them together. Do you see any one of them here? Do you see any more mood stabilizer? I see phenotime. It's a seizure medication. It's a mood stabilizer. I don't see lithium there. I don't see anything. These are the two that I have. Right? If you're watching carefully, there's another SSRI here, which is what? Escitalopram. That's another group of SSRI, right? You got to go through, you do the puzzle, you may mix it, but you can come back. There's another SSRI. Now, olanzapine is an antipsychotic. This is a second generation antipsychotic. So I can put second generation together. Olanzapine and clozapine look the same, right? Risperidone is another second generation antipsychotic. Do you see any more there? Aripiprazole can be classified second generation antipsychotic. You see what I'm doing? We may find one, we may mix them, but we'll come back. Selegiline is what? MOIs. MAOIs. Therefore, if I secure you, I'm looking for MOI. Aprazolam is not. Flunitrazole is not. Nortriptyline or that, they are not. But this one, Fluoxetine, is a MOI. You see, I'm showing you the strategy, and I don't see any MOIs anymore. I see aprazolam. This is benzos. Therefore, I'm looking for benzos. I go benzo. There's no benzo here. This is a benzo. Chlordiazepine. This is what you use for alcohol withdrawal. I see another benzo here. Lorazepam. Flunitrazole. It's a first generation antipsychotic. It's the same thing as what? Haloperidol. Right? See what I'm doing? Now, I see nortriptyline is what? TCA, tricyclic antidepressant. Imipramine is also TCA, and amitriptyline, you see, look the same thing as nortriptyline. It's another TCA. So what am I left with? Dextroamphetamine and methamphetamine. Amphidate. You can see that they are the same. This is used for what? ADHD. And you're done. If you do this every day, you write a bunch of and psych medication on a sheet, and you keep on circle multiple times, different time, all the time, and keep on doing and doing it. When you see the medication, you say it's an SSRI, or I care about what? Serotonin syndrome. The other symptoms and suicide. The other sexual dysfunction, weight gain, GI upset is expected finding. If they give me priority, I'm going to pick what? Suicide and serotonin syndrome. That's all. That's step what? 5. And the most important step of all the steps that we have. If you master this, trust me, it will become easy. But that requires meticulous doing this every day so that you can be comfortable. You train your brain. When they see this medication, you know what it is. Now, after that, I have to give you a few study plan. You can take this and use it for like a week. And when you do it, you can see your improvement. I'm not saying you can be perfect, but take 1 to 2 days to do all the antidepressant, study them, group them, and do some question. The third, fourth day, go to antipsychotic, followed by mood stabilizers, anxiety medication, ADHD. And day 7, do a comprehensive question like 50, 85 on Psych Med and see your score. You should see some improvement. You see some improvement, you know you've mastered the content. And never stop looking at them. Never stop going back to step 5 because that's your key. That's how you can master them. Now let's put it together. Which statement require immediate follow-up? Like I told you, that's what they're going to ask you. Bad stuff. And this is caring for a client. You prescribe what? Fluoxetine. You have to recognize what medication is. And then you look at the answer choice. I have trouble sleeping. I feel nauseated. I donated my car this afternoon. I felt what? I still feel hopeless. Then stop the video, put down your answer, let me know. But if you look at it carefully, fluoxetine is what? Antidepressant, specifically SSRI. If it's an SSRI, what is the major side effect? Serotonin syndrome and what? Suicide. If you feel you have trouble sleeping, you have depression. If you feel nauseated, it causes common GI symptoms. If you're still hopeless, you still have depression. What do I pick? Number 3. I'm picking number 3 because donating your car to somebody means you're giving up. You're checking out. You're about to commit suicide. That's 3 is the right answer. And this is monitoring a client taking lithium, which finding indicate toxicity. Test, find tremor, severe diarrhea, increased urination. Like I said, buzzword is the key. What is the key? Lithium. What is the major side effect? GI side effect. What do I see is a GI side effect? Not test. If you test it, that means you need more water to drink. Lithium also causes thirst. It makes you feel dry. It also gives you tremor. But the one that showed toxicity is severe diarrhea. Number 3, NS is assessing a client after IM injection of haloperidol, which finding require immediate follow-up. Select or apply. If I give you haloperidol, what should you worry about? Require follow-up. You know this is what? Antipsychotic, first generation, right? What are the major side effects? NMS, followed by EPS. But there's a bunch of other side effects. Which one should I worry about? NMS is things that kill you right away. EPS is motor dysfunction. What is the problem? High fever, I don't like it. Muscle rigidity, I don't like it. Hypotension, I don't like it. Tachycardia, I don't like it. Altered mental status, I don't like it. What does that mean? You have neuroleptic malignant syndrome. These are all consistent with giving haloperidol, which are bad side effects. The nurse should intervene and require follow-up. Which lab value is most important to monitor? Prescribe clozapine. You have to recognize that clozapine is what? Second generation antipsychotic. What is the major side effect of clozapine? Agranulocytosis. Which one is going to tell me that this is agranulocytosis? Not potassium, no platelet, not hemoglobin. It's what? WBC. Number 2 is your right answer. And the last one, I know you get 5 out of 5. This is just teaching you how to do this kind of question so that you can memorize the concept and use it to apply. And this is assessing a client suspected of what? Extrapyramidal symptoms, right? Which medication class in the medical record should the nurse hold? He has extrapyramidal symptoms. What do you think is the major side effect of medication that causes EPS? Which one? Is it SSRI, antipsychotic, benzodiazepine, or buspirone? Buspirone is atypical, right? Benzodiazepine is anxiolytic. Antipsychotic causes NMS and EPS, and SSRI don't cause EPS. Therefore, number 2 is your right answer. This is adapting class, psych medication with practice question, strategy, test-taking strategy to answer them and how to learn them. Use this strategy, and I want you to stick to number 5. This will make you comfortable. You're going to answer any question. If you need the actual content for individual medication, check adapting class, or on the screen, you will see the next video. Watch it. It will give you the content. If this video helped you, just click the like button, write a short note so that we can improve this channel. Take care of yourself in NCLEX school and for the NCLEX. Bye.